It's business as usual at the County Commerce Bank in Oxnard, and that's a good thing, because at one point, the bank's active and energetic president, Joe Kreutz, was anything but active.
About 2.5 years ago, I had 3 strokes at one time and was paralyzed on the right side, and was at another hospital for about a week in the intensive care unit. And then, because we knew Cherie Andrews, we had heard about St. John's Hospital being one of the premier acute physical therapy stroke centers.
Joe was transferred to the acute rehabilitation unit at Dignity Health St. John's Regional Medical Center in Oxnard. Immediately, he experienced the expert care and human kindness he heard about.
Obviously, nobody's prepared for a stroke and being paralyzed, but I can tell you that the people that run that unit and work there are so dedicated and made it so enjoyable. Their enthusiasm took a really dark time in my life and made it, turned it around, and by the time I walked out of that ward, I definitely was on the road to recovery.
Improved patient outcomes is a main reason St. John's is a certified primary stroke center, as well as fast CT scans and specialized training.
We also have a full-time stroke coordinator, and her responsibility is to look at each of our stroke patients and make sure that we're providing the right level of care. Have we ordered the right tests? Have we given the right medications? Have we done education? Are we doing everything that we need to do to make sure we're giving the best care possible?
Joe says he has no doubts he received the best care possible.
So how's the family?
The family is great.
Back for a visit to St. John's, Joe sees Cherie Andrews from acute rehab and thanks her and her team for getting him back to life.
Great. It's good seeing you. Cherie. You look awesome.
The St. John's acute rehab team of doctors, therapists, and specialists work with countless patients like Joe to help them heal in the best environment possible. That means all private rooms, all on the same floor.
There's area hospitals that have acute rehab, that they have their the beds or the nurses station on one floor, the therapy's on another floor, and they're spread out, and you have to take elevators or stairs to get to it. So it's nice that it's all on one wing, and we're pretty self-contained. We call it our own little village up there.
Another feature unique to St. John's is the healing garden, a perfect setting when the rehab patient is ready to take that next step on the road to recovery. For Joe, it was a step in the right direction.
What I found here, it wasn't just I'm a patient where I walk in the door and I go through a regimentation and the therapists show up and they say do this, do that. They really took an interest in me while I was here. I mean, a real personal interest. I can't emphasize that enough. They were supportive of me. They made it fun. As depressed as I was, they gave me a new outlook while I was here. They were very supportive of my family. They made them feel comfortable. They allowed my wife to stay there and give with me 24 hours a day, which was really important for me.
Back to work, Joe makes the rounds with his staff to ensure customers are the priority. He's appreciative of receiving that same treatment when a patient at St. John's.
I do feel right now that I'm 100%. Most people don't even know that I had a stroke, let alone 3 at one time. I feel like I've made 100% recovery, and I feel that without St. John's, I don't know if I would have made that recovery.